Hello and welcome to our Friday webinar. It is Friday already. Oh my goodness. Hi,
Yes,
and
it
we're with
is.
Dr. Tully for another great episode of Ask the Vet. And hi, Dr. Tully.
Well, hello, Laura, and hello to all of our webinar attendees. It seems like I was just here. I don't know.
It does. You were kind of 200th
I
episode.
just
You
was
joined
here
us.
a few weeks ago, or was it shorter than that? But anyway, good to be here and looking forward to another great session of whatever we're going to find out.
That's
Only
right.
attendees know, right? Because they're the ones asking the questions. So there you go.
That is true. And if you do have a question for Dr. Tully, make sure you use the Q&A button and not the chat feature button. And I like that you showed up dressed the part today. Not that you don't in the past, but you got the white coat. Says we're definitely
Oh,
with Ask the Vet. So no, no, there's no mistake in that.
yeah. Well, yeah, here I am. Look, I'm even wearing the stethoscope. That makes it
Right.
official. This is the
You
official
ever just
garb.
go out in public like that, like go to the
Yeah.
coffee shop or go to a restaurant and you're like, Doctor.
Yeah, you get the veterinarian costume for young children. You have to have the stethoscope, wear it around your neck just like they do on TV,
That's
and
right.
then you're ready to go. You don't even need to go to vet school. There you go.
Just look
But
the part.
no, I'm on clinics, so seeing patients today, and then also we're in the middle of a big research project looking at trying to find out more information on ligament repair in birds, which there's very little known, and hopefully with this research project that will uh, advance the knowledge of ligament repair in birds almost 100%. So,
Wow. All
you
right.
know, so that's what we've been doing for the last 2 weeks. So a lot happening here at
Well,
Bill issue.
we
Yeah.
appreciate your time then, especially so given that you're coming from clinics and doing research while we're just getting your time
Yeah.
here. That's awesome.
Yep.
Uh, so if you're joining us, well, you are joining us if you're here, but tell us where you're joining us from because we like to see that, of course. And okay, let's see. I think we should get this. Let's see. We got. I'm sure we will have some interesting. I love to see what we get because we never. You're like the only guest that we have that has no clue on what they're going to encounter during these episodes. Because I mean, some are familiar, but you might get questions that you also have never heard before. So it's very exciting.
Well, I mean, really, for the individual question, I haven't heard it before, and that's also it's kind of like a box of chocolates, right? I've heard that somewhere,
Yeah.
and so it's also kind of exciting for the webinar attendees. Well, what's going to come up next, And so it's like, well, it's a grab bag, you don't know what you're going to get, and that's kind of the interesting part of this, and then hopefully we all learn something from this, and maybe a little bit more information as to what, why, how, and what's the significance of that as it relates to the birds that we love. Yeah.
That's right. Okay, so we have a question from Adrian about the use of Silvadene cream on wounds, like alone, or mixed slash dilute with chlorhexidine, coconut oil, or something else. So, thoughts on that?
Well, well, I mean, we start off with a home run, because Silvadene cream, silver sulfadiazine, SSD cream is an antimicrobial cream. It's not an antibiotic cream, and so you say, or ointment. So you go like, well, what's the diff? I mean, the difference is that one has an antibiotic and one doesn't. Like Neosporin. Neosporin has really kind of a triple antibiotic in it, uh, whereas silver sulfadiazine or Silvasorb is another product, has silver in it. Silver is an antimicrobial, and that antimicrobial is also effective in reducing or with the effect of preventing bacterial or treating bacterial infections. And so you're looking at really treating an infection, killing the bacteria through the means of a product that's impregnated with a compound or a substance that is conducive to death of that organism or the lack of reproduction of that organism. So silver is a very good antimicrobial. They use that quite commonly in human if you have an infection, as far as treating human infections that are difficult to treat. Now, this is a cream, like an ointment. This SSD, silver-sulfadiazine, and it is effective, and we use it quite often in treating. Now, the one thing that you have to remember, wound care is one of the most common presentations we have in veterinary medicine, in all animals, and it's no different in birds. And so how do you treat that? What you're looking to is treat the wound, hopefully preventing any infection. But if you do have an infection, treating that infection and making sure that that wound heals in an appropriate manner as soon as possible. Now, the challenge with birds is making sure that that wound heals as quickly as possible without complicating matters. What's the complications with utilizing something like silver-sulfadiazine, a cream, or a Neosporin ointment, or if you have mupirocin, which is an ointment, or an antibiotic ointment, or Neosporin? The problem is that a lot of times there is a liberal application of these ointments. And so what happens is that it complicates the healing process, because all of a sudden the feathers become overwhelmed with cream and ointment. And so the bird looks like it's gone through a oil vat. Okay, the feathers are all stuck together. There's all of this cream and things, and ointment, and it's all matted. The feathers are matted. The bird is greasy, and the bird is going crazy because it cannot groom. And so you put a psychological, stressful situation on an already condition that needs to be addressed, and that's bothersome. And so you have these two situations that you have as it relates to a wound care problem. So it's not only being able to treat the birds, but what you need to do is make sure that you do it appropriately. And then when you're treating and utilizing these products, you want to make sure you do and utilize the information and the product very lightly. And I say when you apply it, you just make it glisten. You don't have any extra. You don't have any extra ointment. You don't have any extra any excess. You just glisten the area with a Q-tip, or what we call a cotton-tipped applicator. And so you don't have all of this excess globs. I'm going to use that term, glob, of ointment. Yeah. So this is something that you need to make sure that occurs. And then Also, what you're looking at is the question was, do you use chlorhexidine? I think it was chlorhexidine or something else with this. And you can, one of the things is that you want to clean the wound. You want to get all of the debris out of a wound. You want to make sure that the wound is treated and prep. We call that preparation of the wound, so that you have direct contact with the affected area by the regulated amount of silvasulfadiazine, neosporin, Silvasorb, or whatever. And you can prep the wound with chlorhexidine. Now, the one thing with chlorhexidine is that it does somewhat cause some inflammation due to its nature to the wound. Now, this could be a positive, but it could be a negative effect. But you have to consider that you want to use dilute chlorhexidine, and chlorhexidine mixed with Silvasorb, I would say, is that you would, if you need to have the chlorhexidine, to use chlorhexidine to prep the wound, and that you have a clean wound for the Silvasorb on there, and that you don't have continued contact with chlorhexidine over the time that you're utilizing it, and that it's for a temporary cleaning and disinfecting of the wound on that. So that's kind of what you're looking at. And then the one thing that also you can consider when you're putting ointments, or you need to apply, or you are requested to apply some type of an antimicrobial or antibiotic ointment to a wound, is that that you say, well, they say just I remember Dr. Tully on that Lafeber webinar, just make it glisten. Well, a little bit is good to glisten, but a little bit more is even better. We're overwhelming the bacteria. Well, the one thing that you have to remember is, and again, we already talked about making the bird, just like the feathers all sticky, matty, and all, it's going to be very difficult to get that ointment out of those feathers, and it's going to be, very stressful to try to clean that. It's almost like an oiled bird. Is that wounds need oxygen. They need to breathe. I would say the cells need to breathe, okay? And the cells need to breathe. And if you can imagine you trying to breathe with somebody putting a big amount of Vaseline on your nose and mouth, how well will you be able to breathe? You can't. So that's what you're doing when you put a whole, then you cover it in some kind of an ointment. The cells at the site cannot breathe, and that reduces the ability of that area to heal. Okay, they're going to get from the blood, they're going to get oxygen, but it reduces the cells that are growing on the top. It reduces the oxygen locally. So the less that you have on there, the more that tissue is going to breathe and heal in a quicker manner. So there's a lot involved in wound care, and especially as it relates to using ointments, antimicrobial or antibiotic ointments. But the biggest problems that you have when it's part of the treatment protocol is putting it on correctly, and making sure you don't have access, and you have the correct the ointment in there. And I would say by not mixing it, that it would, and depending on what you're mixing it with. At one time, we mixed preparation H, okay, with antibiotic ointment, because preparation H, the hemorrhoid, to reduce inflammation, swelling, pain that may be associated with hemorrhoidal, hemorrhoids in humans, that would have what they call the live yeast cell derivative. And what this live yeast cell derivative would do is to promote oxygenation, and also it would promote epithelialization, which would be healing of that tissue and cells at the site of the wound. And so that would be no different than you using it or mixing it with, say, Neosporin on a little infected area of your hand and or cut, and that it would heal quicker. That's one of the things that you can mix things with, and substances with some of these antimicrobial ointments and antibiotic ointments or creams, but you want to make it more synergistic, where you have the combination is better than the individual components, not reduction or the effect of either. And that would be where I think chlorhexidine may be, mixing it may be more problematic because of the inflammatory aspects of that antimicrobial solution, even if it's highly dilute. But that's something that one needs to consider. Some things that can be mixed, but when you mix those, it has to be targeted. Why are you doing it? What are you using it for? And in the end, does the combination work better than the individual components? That has to be all taken into consideration. That's what I take into consideration when I'm prescribing a treatment regimen for the patients for wound care. It's an excellent question, but in human medicine, they have infectious disease specialists. Okay, this is you have an infection, you have open heart surgery, and the next thing you know, you have an infection in the incision site. You have knee surgery, knee replacement surgery, hip replacement surgery. You have an infection within that area. These are all issues where there is a branch of human medicine where there's an infectious disease specialist that comes in and treats those very difficult infections. And so I know this was somewhat, well, do you use this or that? But you bring home a great point, and you look at what is considered, because there are a lot of options and there are a lot of products out there. And I can tell you, when I go to a conference, one of the things that I'm doing is going through that exhibit hall, and I am looking for the latest, greatest wound care product out there that's going to help me treat these wounds that birds present with better, or another option, because each case is different, and depending on the bird, depending on the location, depending on the severity, each one is different, and that's what I'm looking for, to give me another option that may just fit one of those that previously hasn't. So that is one of the big things that I look for, are new wound care products that are are out there, and people are developing them with the improved technology that we have. And then also we get wound care products that work really well. And for whatever reason, the company goes out of business or it's bought out and they discontinue that. So there's a lot of reasons why we have to always look for something new. Yeah.
Wow. Okay. We have a
Yeah.
lot to know about wound care. I just don't know, unless you're talking to you.
I hope that that kind of sheds light. I know that it seemed like and that's what happens. I mean, some of the attendees ask what appears to be a simple answer, and that's what a lot of people go in and say, well, gosh, it's a simple condition. It's a simple question. Well, it may be a simple question, but the answer can involve many facets that's going to take into account. And I hope that our webinar attendees understand this. And that's what we think about when we are looking at a case and having to try to decide what is the best
Yeah.
treatment option for that particular patient. All of these things are going into, our mind as a doctor. And it's just not like, oh yes, it's a simple answer.
Wow, that's fascinating. It peeks behind the brain there. Got a question about a new budgie, baby budgie, about 8 weeks old, 8 weeks old budgie. They want any advice that you have on how the best way of going to taming them. They don't know if it's a he or she, and making the baby feel at home. So, got a new little baby budgie, 8 weeks old. What's your best advice for making that budgie feel at home and maybe liking them, taming the budgie?
Well, I kind of refer um, to Dr. Irene Pepperberg's work with Alex the African Gray. Okay. I think that if we ask any one of our webinar attendees here, that they may all have, and those that have experience with birds, we may get everyone have a different answer. Okay. And I think what Dr. Pepperberg, kind of one of the things that her conclusions in working with Alex is that she showed, by working with Alex, what the potential of a working with a bird can have. And I don't think that every bird has that potential. Just like every human has the potential of being a Stephen Hawking, okay, or a Bill Gates, or for that matter, you look at any great athlete, a Messi, for instance, on in football. You just that is. That's not the case, but everybody could go out and play, okay. But and if you play long enough and you can reach your potential, whatever that may be. And so I think each bird has a certain amount of potential, and what uh, in general, what Dr. Pepperberg came to is that not all birds could be Alex, but if you work with those birds and interact with those birds, especially from a younger age, that that you can reach that potential of that bird's ability, whatever that is, in doing that. And that there's a lot of information out there on budgies, and and how well that they can interact. But I would say my recommendation, if you really want to get the most out of that relationship, it's just like any relationship, right? You know,
Mhm.
that's a human to human relationship, a human to dog, horse, whatever, bird. The more you put into it, the more you get out of it. And I think that that's my advice here. And then and so um, and however much you put into it is going to determine what potential that little budgie has. So you can do your own behavioral experimentation on this little budgie. See how much you can get out of this by how much you put into it, and then give us an update on a somewhat regular basis on how you're doing with that.
Oh, it's a great idea. All right. Yes, do that. That would be, that's a great idea. All right. Yeah, we're just starting out, 8 weeks old. We got a long,
Yeah,
fruitful
yeah,
life. Okay.
yeah. Do you have anything, Laura, to add to that as far as I mean, you've been around birds for quite some
I
time.
have, I mean, I just, respectful interactions is, like not, especially with the little budgie. I found that to be, most fruitful is, kind of getting them to relax around you was the first step. I mean, I've never with one that little, but like, when I've taken home adult ones in, just, getting them to relax around you a little bit, work at their comfort has been better than like grab it in the cage kind of stuff.
Yeah, yeah.
And
All
food, treats, they love, you give them a good treat and they'll,
right.
that's the icebreaker right there.
Yeah, give them a pumpkin spice NutriBerry, right?
There you go. Product code. Pumpkin spice Nutri-Berries comes in veggie size.
Yeah, there you go. Yeah.
All right. I have a question about a cockatoo that has this one I cannot ask any offer any insight because this is all you. It's a 43-year-old cockatoo that has a small sore, kind of like a pimple on his bottom. He doesn't pick at it. It's not the cloaca. So he's lived with a smoker for 30 years. He may have heart disease. You can hear him slightly straining to poop, and the poop smells, but no issue with being able to poop. So he started to pick at his chest, but no visible damage. And he has an appointment Thursday. They want to know if they should have anything in particular checked. So,
Yeah, I mean, that's great that you have an appointment. And there can be a number, of different conditions that are associated with this. And how old is the bird?
43-year-old
Oh,
cockatoo.
it's an old cockatoo, but it appears to be doing well, and that's like when you look at it, you go like something you mentioned, heart disease, and so you look at an 80 to 90-year-old human and said that may be heart disease. And I can guarantee you there's cardiovascular, what we call pathology or tissue change. And so you can say that there's cardiovascular, um, it does have cardiovascular disease. Any human at that age would have some degree of that because of 80 years of just good use if you're still going around, and then also the natural aging of the it's just like a machine. You just keep going. There's going to be use, and there's going to be breakdown, and there's going to be repair and all of that stuff, and over time, yeah,
Mm.
you're going to have that. And so I would say this cockatoo does. It has probably has cataracts, lens opacities, which would not be, which would be common in a bird of that age. And so the one thing is to you're going to have to, exactly try to identify this situation. The bird's stool, fecal material shouldn't smell. That if it has an abnormal smell, to try to identify what may be associated with that. You always look at what the bird's eating. Is there anything changed? If there hasn't been, then it may be due to change in the flora within the microbial flora, the microbiome, if you will, of the GI tract. And with that change, you have kind of a kind of a difficulty. You have a change in the microbial population of the fecal material, and therefore you have an abnormal smell. The bird's breath shouldn't be offensive, or neither should the fecal material. If it is, that is usually a sign that something is amiss and should be investigated. And so as far as this small area of interest around the vent, that should be again looked at, and that the doctor's gonna assess that and determine if it needs to be biopsied, or if it is is it a ingrown feather, small ingrown feather cyst there, that's just kind of bothersome, but not associated with the smell or and then also you have the feather destructive behavior, as you mentioned. And it's this feather destructive behavior associated with what's going on in the intestinal tract. And I think that this is a great case to try to get an assessment of what's going on inside. I talk about, a physical exam. Well, we can look on the outside and say, oh, well, this is what's happening. But what's going on inside? Because what's going on inside, it through your complete blood counts, and then your biochemistry panel, which we get when we have physical exams. That's what's going to give us an idea of what's going on inside, and give us more information to try to tie together everything that we can see, and what the historical story is as it relates to that particular patient's condition. And that's what is going to be helpful. So I don't think that there's anything that's specific here, but definitely an assessment of over 40-year-old cockatoo is important, both inside, outside, while looking at the presenting complaints, as we call them, or the abnormal, overt, obvious clinical signs, and to see if they are correlated, or that we have just multiple conditions that are unrelated. That's all what we have to see. Now, of course, if they're related, then you treat what the underlying condition is, and whoop, hopefully they all go away. But you may have to treat, if they aren't related, then you may have to treat one. You may not be able to treat another because of the, just the age-related issue, or something that can't be treated. So you may not get a complete resolution of everything, but you reduce the number of problems that are present.
Okay. And just a real quick question for me is, when you're bringing your bird in, especially if the poop is an issue, is it enough to just when you're like the poop that's in the travel carrier for you to look at, or do you prefer to have like a whole, like, so I imagine, you bring in the bird and you can also look at their droppings. Should you have the droppings from like the day before, or is the droppings on that they drop on the way to the vet or at the vet enough for you to kind of get any kind of insight from?
Well, usually, if the bird's eating and has been eating, there are going to be droppings in the cage. Okay. If the bird gets a little bit, if it's stressed, and apprehensive, which it is, you may have, got it. The bird knows it's in the carrier. Oh, where are we going? Usually it's like nowhere good, right? Going to the doctor, and I don't think anybody likes the doctor. But there may be some type of, the only time I get in the carrier, I go get my, booty looked at, and they hold me and they stick a needle in my neck or what have you. That if they're somewhat stressed, they will defecate, but sometimes it's more they can just urinate more than having fecal material. But usually, Laura, that's a good question. The fecal material within the carrier is adequate. Usually, that's adequate.
Okay, good to know. Serious. All right, we have a question about, oh, okay. Would an older budgie develop sensitivity to veggies that they were always able to eat? So if they develop diarrhea after eating, can you use apple cider vinegar in their water? And can regular use of vinegar damage their digestive tract?
Um, so the um the initial um the initial question was the bird developed allergies,
Sensitivity to veggies.
sensitivities to
Well, I
veg.
think now it's like diarrhea when they eat what they previously would eat with no problems. It appears they have diarrhea when they eat it now.
Yeah, yeah. Uh, the one thing that I would mention, my thoughts on that is that I'm not sure if it's necessarily a sensitivity to the vegetables, if they're eating vegetables and they're having diarrhea. Um, I don't know what type of bird that is in particular, uh,
Veggie.
a budgie. Uh, the the budgie for the most part is a bird that is kind of in a dry climate and naturally, and does eat quite a bit, in the natural diet, and has developed where it eats a lot of seed, right? And so if you give pellets to the budgie, and it eats primarily pellets or seed or nutriberries or nutripellets or what have you, the kind of the bacterial flora that's normal for that GI tract produces the little bullseye fecal droppings that you normally see, black with the little white urate drop in the middle, a little bit of frosting in the middle. And so that's kind of normal, but also you can with the pellets, you can have more of uh, a stool that is not typical like that. And so, in with my budgies, I have a pellets, feed them a millet spray, and avocakes or what have you. And so the little budgie fecal material isn't it hasn't been that little black with the white spot, but more it's more of a softer brown tannish color stool. Now, that's the way it's been with that type of diet. Now, I don't think, you know, that I would say that I don't think that the birds have developed sensitivities to the vegetables. What I think you have to look at vegetables, and I don't know quite what vegetables you're talking about. There usually is a fairly significant water content to those vegetables. Okay. And whether it's bell peppers, whether it's carrots, what have you, there's also fiber involved. So it's you know, it's a moist diet, and also it's a diet that's going to affect the microbial flora of the intestinal tract. So it is a possibility that the birds are not necessarily sensitive, but that the birds are, it's just the makeup of the diet that's causing it to have a different presentation. Okay. And then the question with that, Laura, was what?
About regular use of apple cider vinegar. Can it damage their digestive tract?
So the apple cider vinegar, you know, you have to look at, you know, anytime we add any type of treatment, supplement, or additive to a patient, okay, or recommend it. I want to, you know, I do that with knowing specifically what it does, and 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 what the side effects are. Okay, because usually if you add a you know, a supplement, there are side effects with that. If it's not a natural ingested food item. And so that's even vitamin mineral supplements. You can add it too much. This is what the consequences are if you get too much of that. You know, vitamins or minerals, and how does it affect the flora? So when you look at apple cider vinegar, what benefits are you getting from that? And I'm not talking about, you know, well, this is what they say. What have they found out that's concrete evidence that the apple cider vinegar is effective or has these benefits in parrots? You know, well, people say this. Well, people say a lot of things that there's no substantial evidence or whatever, you know, and people's eyes are what sometimes they want it to be, you know. And again, it could be like, well, this is, I have seen results, and I don't care what he says, it works great. Okay. But I'm saying if you're doing it, you need to, you know, if I'm going to recommend something, I'm going to try to utilize the best, you know, objective information possible to make that recommendation. And with that, you know, yeah, you know, it's just like, what are you trying to achieve? Because I think if you, you know, have regular usage, will it cause any problems? Well, how much are you given? What is the you know, the amount? How often? And well, you can be doing an experiment on yourself, you know, with your own birds, and say, well, I've given this much, and I've given it for this long, and I haven't had any problems. Well, you may see, you know, where it has a, and that's something in and of itself. And but what does it do on a positive manner is something also to assess. Not doing anything is kind of like the probiotic supplementation. that I've talked about in the past. Well, you can give probiotics to try to improve the microbiome of that, but it needs to kind of be species specific, and at least an avian, I guess, concentration of microorganisms to possibly get a beneficial effect. There hasn't been a robust, amount of or substantial amount of information that says probiotics do exactly this if you use this product. And so what we found is that it doesn't do any harm. So you can look at, well, we know what we're trying to achieve with that. Now the question is, so, well, let's just give it because we want to put good bacteria in the GI tract because it's going to promote a healthier GI tract, have bacteria that's helpful in absorption and in the actual function of that GI tract at digestion, okay, and also in the grand scheme of things, with good bacteria, that prevents bad bacteria from actually adhering to the intestinal wall. So we know what we're trying to achieve. Now, what are we trying to achieve with apple cider vinegar or something like that? Well, we just hope that it gets better. And how is it going to do that? And what is it going to do? And so I can't tell you that it's not going to be, there's what side effects that there are. Well, just, people giving it. Well, that's good. And you can do it with your birds. But I can't tell you what it's going to do or how it's doing it or why it's doing it, or if you're going to have an issue with it. So you do it at your own cost. And just because somebody says it works, well, that's no basis other than that hasn't hurt their birds. So that's with any supplement like that. On that, I think I just saw a show, Apple Cider Vinegar, on Netflix.
Yeah.
And I think it was promoted to heal cancer, but it didn't in the long run. But it's, I think that kind of sums up what apple cider vinegar's reputation is out there, that it's good for everything, with no evidence that it does anything, So if you want to use it, I can't say, I don't, I don't know what amount or how much would be the most effective, or if you're going to get any benefit at all. But as I said at the beginning, I think that what you're looking at is an increased, it's not a sensitivity here. I think it's more a, where you're having a, increased water, fiber, and I'm not sure what vegetables you're talking about that's usually involved in that, and that is just causing a difference in the final fecal presentation, which is different than normal. And you said, well, initially it looked good. Well, sometimes it just takes a little while for that microbial flora to have a change enough to affect what the ultimate, fecal presentation is. So initially, until it changed over, it looked normal, and now and the bird said, oh, I like this, I'm going to eat more of it. And sometimes it may be associated with what type of vegetable you're feeding. You may have started with something and then you started, changed it. So all of that has an effect on what's going on physiologically within the intestinal tract.
Okay. Question about someone wants your thoughts on using Lupron injections as a treatment for testicular tumors in male budgies. So male budgie with testicular tumor, is Lupron injections okay for treatment?
Well, let's put it this way, and that's a great question. And we have tried that, and I know that there's a number of well, there's not a number, but there are a few reports of utilizing Lupron, and it's a hormonal um, injection for those who are not aware, that kind of reduces the activity, and we'll use it for female birds to try to decrease ovulation or egg laying. Okay, and so this is what, and we seem to have a benefit in that, where you can put an implant, 4.7 milligram implant on the skin of birds, and that kind of reduces that. We've used it in cockatoos that have to reduce the hormonal effects of prolapse cloacas, um, uh, to mostly a lesser extent on reducing that um, condition for a short period of time at least. But when you have a testicular tumor, there has been reports that the Lupron injection will kind of reduce as what I would call a palliative treatment. We're not curing the bird, but the objective is to reduce the um, size, possibly, if you're looking to have a surgery to remove the tumor, which is a very it poses a lot of risk to go in and removing that testicle, and that testicular tumor right at the near the kidney. And so as far as my thoughts are, is that we have tried that. There's some, as I said, there's some written reports of utilization where there has been a response. I would say that in most cases, you don't have anything to lose by trying it. But I think that the expectations of having a significant effect would be not very high. But at the same time, treatment for cancer, and you may, and some of the webinar attendees may realize this or have knowledge of this, is dependent on what type of cancer they have, a patient has, whether it's a B cell or a T cell lymphoma. One's more treatable than the other, whether it's an adenocarcinoma or, it's a, some other tumor type. Fibroadenoma is an adenoma, it's an adenocarcinoma. So there's different cells within the testicle, and each one may respond or respond less to Lupron. So like I said, there's nothing to lose, and unless you know what type of particular cancer it is, it may or may not have, and I don't think that there's enough information out there at this point to say that one type of seminoma versus a Leydig cell tumor or what have you in a testicle is going to have a more of a response than, or less than a response. But that's a great question. That's where we're utilizing different different treatment options to try to have an effect. And I can tell you that if you read something that says, "Oh, this is it," and it takes care of the tumor, caveat emptor, buyer beware, because not all of that is true. Each case is different, and I would say that that it is an option for palliative treatment, but not something to look for a resolution. And palliative treatment just means treatment to increase the quality of life for a longer period of time, and you're not looking or can't resolve the cancer.
Okay. I think that's all of our time for today. Yeah, I know, went by quick.
Well, we just started.
I know we just started.
Uh,
Well,
they,
I was
those were great questions, and I can tell you, Laura,
yeah.
a lot of them touched on things that we haven't talked about. And I think that the wound care, starting it off, was an excellent question, because that is one thing that we see. And the last, and I just get disappointed if I, see, I don't want the bird to have to go through where it looks like it's been in a fight with a vat of Vaseline. If it's treating a wound, the wound is problematic. And when you treat that wound, you just make it glisten. There should be no excess in ointment or any type of cream. It should just be glistening. Any excess is problematic.
That is
You know?
fascinating. I wouldn't have even thought of that. I mean, that's really good to know, because I think your inclination is, as if you're putting stuff on you, even, is just to kind of oversaturate the air, like put a big glob on. So
Yeah, exactly, exactly. And more is not. And then I mentioned about the respiration. That your skin is getting oxygen. Okay, you're not necessarily breathing in a sense through that, but that for health, it isn't within the getting oxygen. And so if you cover it, now it's going to be more effective when it needs the oxygen to heal. But I mean, it's going to be more problematic, or you need it when it heals. But for the most part, you need to make sure that that new tissue is getting that. Yeah.
right. So for humans, for us, skin's the largest organ in the body, right? Is that what they say? Like, so we
Yeah,
don't want
that's
to. Same with
yeah.
birds.
Surface area,
Surface area, yeah.
Yeah.
You're saying, yeah, yeah. Would it same for our feathered friends? So, like,
Yes, yes. And also what I wanted to mention is that you think about a hot spot on a dog, or if you have a dog, or you have any type of a mammal, a rabbit, what have you, and you have a wound. Do they have the wound and keep the hair around it and say, just move the hair apart and apply whatever to that area that has hair? They shave it, right? If you have a wound on your head, they're not gonna just get the hair around it. They're gonna shave it. And so you want to make sure that the feathers are from around that area are clear, so that you don't have to lift the feathers and then put it, and then you put the feathers back and they stick to the ointment or whatever. So that's one thing, that it has to be where it's clear of any type of feathers. Yeah.
wow. Okay. So you just said you were coming in from a research on ligaments in birds. Maybe you can do a thing on ligaments and wounds. So, there we go.
Well, we have to get the results, you know, but wounds,
They kind of seem like they have a
I can
parallel, like
think
they kind of
of.
go hand in hand at times.
Yeah. Oh, yeah.
It's
Yeah.
just,
Yeah. But wounds in particular, yeah, because
okay.
that's one of the common things. Yeah.
Wow. Okay. That was I really got a lot of, I mean, that's I wouldn't have thought of, well, most of that what you said. So that was helpful for me. I hope it was helpful for our viewers. I'm sure, I know it was. So
Yeah.
um
We see it all the time. So, yeah.
wow. Okay, so I gotta make a couple announcements. We're gonna be back in September 12th specifically. So Lisa Bono she's going to be going to AFA. It's gonna be September 4th through 6th in North Carolina. And if you're in North Carolina or within no, and I'm sorry, Raleigh. Yeah, Raleigh. If you're in the area or within a drivable or flyable distance, come to AFA, see Lisa. She has some Lafeber products that you probably could score if you're there. So if you're going to AFA, make sure you stop by the Lafeber booth and see Lisa will be there. She's going to present a webinar on September 12th about all that she learned. And you know, Lisa takes really scrupulous notes, so it's going to be very detailed. She's an excellent note taker at these conventions, so I can guarantee it's going to be worth seeing her recap. So.
Yes, definitely.
And then we'll be back with you in September for another episode of Ask the Vet. And I think maybe we could take some of these questions that we got today and we'll put them through for that webinar. We've got a few that we didn't get to, so maybe we could do that.
Yep.
All right. On that note, I gotta wish everyone a wonderful Friday. It's the weekend, so hope everyone has a wonderful weekend planned ahead. And Dr. Tully, it's always a pleasure to have you on, and we'll see you.
Yes, it is, you know, to be here for me and also for all of our wonderful attendees that drive this webinar and make it what it is. Thank you, attendees, and thank you, Laura, for your wonderful hosting. And look forward to next time.
That's right. Okay. On that note, thanks again. All the best
All
to you
right.
guys. Have a great weekend.
All
Bye.
right. Bye. Take care.